Good morning, all. Welcome back in my YouTube channel. Today we will discuss on the topic airborne diseases and droplet infections. See, he is the Edward Joseph Lister Lowbury. He is the pioneering and innovative English medical bacteriologist and pathologist as well as the published poet. Lowbury was appointed in 1949 head of the microbiology department at the Medical Research Council Burns unit of the Birmingham Accident Hospital. And he also taught the pathology as a research fellow at the University of Medical School. So, he is the founder of Hospital Infection Research Laboratory known as the City Hospital, Birmingham in 1964. That is, he is the best researcher in the world of any diseases. Also, he is a bacteriologist, bacteriologist. Now, what is airborne disease? It is a disease. This is occurred or created with the help of the breathing, so called as the airborne disease. Then this disease can be spread when the people with a certain infections, that is cough, sneezing and talk and sweeping nasals, throat secretions into the air. These are the aerosols comes from these infections. So therefore airborne disease spread. Some viruses or the bacteria take the flight and hang in the air or land on the other people or the surfaces. Then in airborne pathogenic organisms, they take up the resistance inside you, and means when we breathe, then aerosol particles, dust particles come in contact in nozzles and then and come in contact in our body. Okay, then also pick up the germs when you touch the surface that harbors them and then touch your own eyes, nose or mouth. Also, these diseases travel in the air. They are very hard to control. We don't catch this air in our palm or any other vessel, so it is hard to control. Keep this regarding to learn more about the common types of airborne diseases and what you can do to protect yourself from the catching them. What is the exact airborne diseases? The disease occur with the help of breathing, and this breathing process, when the breathing process, some infections of cough, sneeze, talk, sweeping nasals, and throat secretions into the air causes these diseases. This is about the airborne diseases. The next one is, what is the classification of airborne transmission? There are the three classification: obligate airborne transmission, preferential airborne transmission, then opportunistic airborne transmission. Obligate airborne transmission, it is the this airborne disease occurs to the aerosol. Example is tuberculosis. Then preferential airborne is the initiated through the multiple routes but predominates by the aerosols. Example is chickenpox and measles. Then next one is the opportunistic airborne. It is occurred through the other routes but by the aerosols in favorable condition, and that is a high risk procedure such as the incubation, and example is influenza and SARS. These are the three classifications of the airborne transmission. Then airborne diseases. This disease caused by the pathogens that are the small enough to the discharge from an infected person in the form of any tiny drops called as the aerosol. Airborne disease caused by the aerosol, and this pathogens remains found or suspended in the air, dust particle or respiratory and water droplets that are the less than 5 micrometer in the diameter. These aerosols are very small in size, near about a less than 5 micrometer in diameter. Then droplet infection, it is caused by the ingestion or aspiration of the droplets carrying pathogen, and these droplets are respiratory secretion is greater than micrometer in diameter than producing during the laughing, talking, coughing or sneezing. These droplets are occurred or produced during the laughing, talking, coughing and sneezing. This transmission occurs when an infected droplets with a short distance in the air and then fall on the host mouth or the nasal mucosa of the eyes. And these droplets travel 1 to 2 meters before drying out or falling on the ground. These droplets directly falling on the ground or surfaces. This is about the droplet infection. Then most important question is why droplets are not considered as an airborne transmission, because the droplets are larger than aerosol and don't remain airborne for the long. Okay, they fall into the ground onto the surface. So these droplets are not considered as an airborne transmission. So airborne and droplet infectious diseases are different. This is the list of the airborne disease and the droplet infectious disease. Airborne diseases are influenza. Both means influenza disease occurred by airborne and droplet transmission. Influenza disease, then varicella, that is the chickenpox, then measles, then anthrax and tuberculosis. These are the airborne diseases. Then droplets is the SARS, that is severe acute respiratory syndrome. This both means this disease is an airborne and droplet infectious disease. Then pertussis means coughing cough. Then streptococcus throat infection. Then Ebola virus infection and norovirus infection. These are the droplet infectious disease. Then upper respiratory tract, all the aerosols and droplets directly attack on the respiratory tract. In this, the indigenous microflora of the that is upper respiratory tract may cause the most of the opportunistic infections. And these infections of the URT, mostly the cold or the sore throats, are the common more than the lower respiratory tract. The symptoms of this upper respiratory tracts are the cold and sore throats, and then may predisposes the patients to more serious infections such as the sinusitis, then otitis media, then bronchitis and pneumonia. These are the some symptoms or serious infections found in upper respiratory tract. When lower respiratory tract infection are the most common cause of the death from the infectious disease. Whenever any airborne disease carry or treated patients in a lower respiratory tract, so these patients mostly cause of the death. This death directly death from this different infectious disease. Thank you. Now I will stop here.